Second, of course, if you look at the other indirect benefits of hand washing, it reduces country's health budget. So either you can spend on health care system, you can spend on providing more healthcare facilities and spend more on disease cure, or you can follow some prevention practices, and one of the disease prevention practices, one of the health promoting practices is hand washing, and that's where we need to focus upon talking of global hand washing day and global hand washing facility. So, of course, the experts sitting here, Theodorus, Tanya Khan, and Lim Ahmed, they are much more experienced than I am on this particular issue, and looking forward to hear from them. And I can, if Mariam allows, I can.
They're better prepared and they're less likely to face the numerous health problems that we see happening. So with this, I'll give it back to Mariam, and perhaps you can have somebody else contribute to the discussion as well. Thank you.
Thank you, Dr. Imran. Of course, stunting in one way is related to food, in another way it is related to waterborne diseases and water as well, and water quality, of course, as well. I would now shift this discussion to UNICEF Pakistan, which is highly active in water sector along with other organizations, of course. I would request Mr. to address this issue, because we see that there are a lot of organizations sitting in this podium as well and in Pakistan which are working in either in collaboration or some in silos to address this issue, and how this collaboration and partnership can help achieve better goals and better impact of such campaigns. And second, that how differently UNICEF Pakistan is addressing this when it comes to marginalized communities who don't have access to sanitation and water services, and who do not have access to sanitation at all. And I would also request you to share some stories from the field, if you have, like what other kind of issues particularly women face in this area when they don't have access to this sanitation services.
Thank you, Mariam. Good afternoon, colleagues. It's a pleasure to be here and share some of our learnings and also experience from the UN perspective. Before I go into, a few questions that Miriam has raised to reflect around why partnership and how that would help us in achieving our goals, I want to share our thoughts how the Global Hand Washing Day is important. Ever since it was launched back in 2008, this has been used as a way of revamping our commitment and bringing a huge social movement in terms of raising awareness around this very basic but highly efficient component of WASH that address the missing link, if you like, in helping households, mothers, children to benefit from whatever we do. Provision of water supply, for example, takes a huge investment plan around infrastructure improvement, around quality assurance, around bringing different skills and capacities, be it in the private sector or government. Whereas a key message on right tone at the right place, which is more on a behavioral change. So it just takes being clear on what we want to really communicate and addressing the right targets with the right tone. And it doesn't necessarily require a huge investment. And through time, when mothers, caregivers, the less to-do households or the rich, once they own and embrace this social change, it becomes like own kind of responsibility and a self-rewarding kind of activity. You don't need to have a huge amount of money. It's just the behavioral change by itself makes people reap off the rest of, the best out of the water supply or sanitation component which the WASH package is bringing. As I move to the next question which Miriam has posed, why then partnership is important? As I said, I mean, the challenge in countries like Pakistan, where we have a huge population, where there is a diverse district, government of Punjab, and Sindh in rolling out and scaling up sanitation, which really helps in covering all the districts, marginalized or the disadvantaged ones. With regards to sharing, I mean, field experience, it's always rewarding to have interface with, I have come across so many mothers who have got, who have become the champions of WASH. If I may share to John, I mean, as you know, these are the communities who don't normally come, organizers whom I have met and discussed. These are community members who have benefited from the program and who have been spreading the good hygiene practice message to the wider community, and who took a pride of what they have done to the program, and who have been helping the rest of mothers to own toilet, to have hand washing facilities next to those constructed toilet facilities or latrine facilities. So always it is really encouraging to see how our programs or piece of projects are transforming, the left out mothers, if you like, who seem not to be aware of some of the basic message that we have been spreading for years, but benefiting from small project, small and little project here and there. So there are so many interesting experience, stories to share, but I would rather rest it here for now. Thank you.
Thank you, Mr. Theodros, for sharing UNICEF Pakistan, of course, Hunsa and other parts of Pakistan as well. I now request Ms. Tanya Khan, who is country head at Water Supply and Sanitation Collaborative Council, to talk about MHM program which you're looking at and what kind of challenges you're facing in particular that sector, because this is such a topic which is kind of taboo in our society, and it's really hard to even talk about it. And how we can, since we are living in digital era, so how we can use digital platforms to communicate about this, such programs.
I would just like to highlight that I think we all are very fortunate, as Mr. Theo from UNICEF has highlighted, that the government of Pakistan has launched a Clean Green Pakistan movement. It's a flagship movement owned by the Prime Minister, so we have the political will. Because for the last 20 to 25 years, as we recall, we have been struggling to have some kind of ownership and political will of highest level on the issue of sanitation, hygiene, and safe water. And we are very fortunate that last year, I think around the same time of the year, we also celebrate 1 year anniversary on October 12th it was launched. So 1 year has gone by, and we are very fortunate that it has provided us with a platform for engaging, collaborating, also building capacity, coordination and collaboration, not only amongst our organizations, civil society organizations, but also other constituencies. and of course hand in hand with the government, because when we say that leave no one behind, we do not, it's impossible for the government volunteerism concept, engaging youth and notables and people from other, segment of society who can come forward and play a very critical role. A behavior change component, as we see, is relatively not that old, in Pakistan, because previously when we talked about sanitation, we would talk about hardware. So when in 2006, the first sanitation policy, when it was formulated and by the Ministry of Environment at that time, which is now the Ministry of Climate Change, the soft program, the behavior change component was the big paradigm shift, So it focused on that if you need to address the issue of sanitation and hygiene and reduce diarrhea, you need to focus primarily on changing the behavior of the people, especially the people in the far-flung rural areas, people with disabilities, people in conflict and emergency situations, people with old age, and people with different other, when they're excluded. So discrimination, which is now the global slogan, they call it EQND, making sure that the government policies and also the policymakers in the external support agencies and the private sector and others focus on how to reach out to the marginalized people. So we look at how we can make sure that through our policies and through our programming, we address the issue of non-discrimination and inequality that we have in our society. And under that ambit, we look at some of the issues which are hushed issues, which are not talked about issues. So there, when we talk about hygiene, the hygiene of women and girls, especially in their days of menstruation, is very critical. Initially, when this concept was discussed at the policy level, there was a lot of reluctance, of course. But then, of course, with a lot of investment and discussions in the sector and some of the government officials coming forward as champions at the federal and provincial level, the issue of menstrual hygiene management is now a critical component of hygiene within the Clean Green Pakistan movement, which means that educating the girls in schools as well as women and girls in the communities, because we must not forget that a large proportion of girls do not go to school in a country like Pakistan, especially in our rural areas and slums. So, so policies have been included at different levels. So it's an intersectoral approach. When we talk about behavior change and hygiene and women and girls' health, we talk about intersectoral approach, because it's not the mandate of one particular ministry or department. It's an intersectoral, so the Ministry of Health, the Department of Health in the provinces, the Department of Education in the provinces, the federal level also, the ministry that is here, the Environment Department, Public Health Department, also Social Welfare, Women Development Department. So all the relevant departments at the
areas, it's not habit. So one of the challenges in terms of the people who are working water sanitation to make its habit. In urban areas, people are mostly less exposed to fecal contamination, and it's a mostly clean environment. So many of us even don't wash hand, we can live without, because the lack of contamination around that. But in rural areas, the setting is different. They don't have mostly a fixed station to wash hand and availability of source. I can tell you a very interesting fact why this issue of priority and making it habit. We analyzed Punjab Mix. Mix is a survey where we find availability, water sanitation, and also hygiene practices. So there was 16% people in Punjab, they had mobile phone, the digital mobile phone, but they did not have soap in their houses to wash hands, which clearly indicate the priority of the people at what they actually think is a social status. And that's where we, people who are working in development sector, need to focus on changing the social norms. And it's not just water sanitation sector, every development, all of us in this room.
thank you, Mr. Nadeem, for highlighting, again, this is the third speaker who said